Only on 4, relief in sight for those battling COVID-19 symptoms months after testing positive. Tonight, Only News 4's Emma Hogue is getting an in-depth look at Washington University's new post-COVID care clinic. She's live near the clinic office in Creve Coeur. Emma?
Well, Corey, this clinic is really the first of its kind in our area, and prolonged symptoms might be a lot more common than you'd think. In fact, researchers are saying about 1 in every 10 people who have had COVID have symptoms that last longer than 3 months. And tonight, the staff here at this clinic are hoping to help.
I got most of the symptoms. I had a sore throat, a cough, a fever. I had congestion.
Back in mid-November, Kyle Button tested positive for COVID-19. The 17-year-old from St. Charles says most of his symptoms subsided after 2 weeks, but nearly 3 months later, he still gets fatigued after daily tasks and can't taste or smell.
We just had a bonfire the other night and I couldn't even smell the smoke. So like if there was a fire in my house and the smoke detector wouldn't work, I would have no clue there was a fire or anything. So it's kind of unnerving.
I wake up every morning feeling sick, feeling fatigued.
In Chesterfield, Misty Veltman says she forgets what it's like to feel 100%. The 56-year-old had rheumatoid arthritis and Lyme disease before contracting COVID in late September. Chills and extreme fatigue have plagued her for over 4 months.
You know, when I get off work, I just feel like putting comfortable clothes on and climbing in my bed. I don't work out anymore. I wish I could work out. It's affecting, my daily life. But I think as the days and weeks go by, it's become my new normal.
The hallmark of COVID thus far is the variability of it.
Dr. Maureen Lyons is the director at Washington University's new Care and Recovery from COVID clinic, also known as CARE. The site is accepting patients with prolonged symptoms at least 30 days after testing positive for COVID-19. Patients are first seen by an internal medicine specialist like Dr. Lyons for an initial visit. After that, follow-up visits are every 3 months for the next year. The clinic collaborates twice a month with a team of doctors from 11 specialties like cardiology, pulmonology, and neurology. Patients are referred and treated by those doctors as needed.
I think it's really important for people to know that there are things that can be done to help their symptoms. And support that can be provided.
Tonight, people still battling stubborn symptoms say they're hopeful. Help is in sight.
That would be pretty nice to be able to go back to normal again.
To feel just a little bit better, to start making progress would be very encouraging.
So bottom line, if you still have symptoms months after testing positive, Dr. Lyons wants you to know it's not all in your head. This is real, and there is hope for you. The clinic is taking appointments right now. You can make an appointment by calling them, and we have that number posted right now on our news app. For now, reporting live in Creve Coeur, Emma Hogue, News 4.